You're watching CTOM TV. Knowledge is power.
So on the targeted therapy options,
Sure.
there's a drug called Anlotinib, Anlotinib. Small trial of about 120 people with previously treated relapsed small cell lung cancer. It was used second and later lines. In this trial, progression-free survival was 4.1 months versus 0.7 months. So obviously the patients didn't live very long if they didn't have anything. And on this particular drug, it's a TKI, so it's a multi-target tyrosine kinase inhibitor.
Mm-hmm.
And so typically what we call dirty TKIs are tyrosine kinase inhibitors inhibit a particular signaling pathway. And so dirty tyrosine kinase inhibitors inhibit many different signaling pathways.
Mm-hmm.
And so they have a lot of side effects.
It's like a shotgun versus a rifle.
Exactly. And they can't be used at the same dosage. In fact, we've seen a few cases of drugs of tyrosine kinase inhibitors that were multiple tyrosine kinase inhibitors just not work at all compared to a single targeted kinase inhibitor. So in this case, it's a different ball of wax here, because we have so many different mutations. These multiple tyrosine kinase inhibitors, these dirty tyrosine kinase inhibitors that are not useful in other cancers, may be a little more useful in this model, this genetic model.
Yes.
Yeah.
Because there are so many mutations.
Exactly.
So having something that covers more bases
is going to be a little better, and you can give it a lower dose than you would if you're just looking at repressing one mutation or one target.
So those are dirty TKIs.
Dirty TKIs, we call them, yes.
Okay.
So in this trial, the overall survival was 7.3 months versus 4.9. And the hazard ratio, the risk of dying, was reduced by 47% during the course of the trial. So, I think this drug definitely is something that has some benefits. And I think, combining it with maybe immunotherapy or some of these other combinations, I think we're going to see some interesting new developments.
And that, when you say this drug, that was the Anlotinib?
Yeah.
Okay.
Thank you for watching CTOM TV. Subscribe below and stay informed.